Thank you, Chairman. And good morning, ladies and gentlemen. I'm Hyeun again from South Korea. This time, my lecture topic is that full endoscopic management of the thoracic spine pathologies. Yesterday, I gave the talk about the endoscopic full endoscopic lumbar fusion, but actually, with the full endoscopic lumbar fusion, the thoracic approach of the full endoscopic is the final hurdle to move from the gold standard of spine surgery by the full endoscopic spine surgery. Because of that, this is a very important issue. And also, before talking, Dr. Newton already talking about the thoracoscopic approach, I will talk about the full endoscopic approach. Yes, we already well known that in the thoracic spine anatomy have some very important myelopathic structures, and it may be related to cord injury. Because of that, we should caution to manage this problem. But if we met like this simple disc, it seems like easy to manage by the endoscopical, but unfortunately, the thoracic pathology usually the disc located some central, and there have some ligament thickening, and sometimes the calcified ossification, maybe some compression of nerve pathology. Because of that, endoscopic approach is not easy still, but we should overcome these problems. Currently implemented full endoscopic approach will be the this paper published by Saga and intraluminal and posterolateral and retropleural and thoracic approach, and also this paper published by Dr. Rehabilitation, you can see here the intraluminal approach and extrafemoral approach, and thoracic retropleural approach will be applied by the endoscopically. But today I will discuss these two intraluminal and extrafemoral approach. Yes, in the thoracic area full endoscopic approach, we can use this small scope and large scope. But in the disc pathology, we can manage this small scope. But like this ossified, calcified ligamentum, and it's needed more large scope because of that. It needed more safely approach decompress the posterior part. But in some cases, like this mixture of some disc pathology and posterior pathology, it needs some combination of this small scope and large scope. And especially like this small disc pathology only target the extrafemoral approach or transfemoral approach. But in the cases of like this posterior and disc pathology together, it needs some large scope and small scope with the intraluminal approach will be more useful. Firstly, we checking some transfemoral or extrafemoral approach of the thoracic pathology, especially disc pathology. This paper, I already mentioned that the Rehabilitation published this technique. In the thoracic disc pathology extrafemoral approach, most important key is some sufficient decompression of the transfemoral space to expose the these images, and to safely approach to the target point. It may be needed some foraminotomy and resection of suprarticular process. And anyway, sufficient drilling to these bone structures will be more safe and more easy to approach to the target point. But this paper published Dr. Bae, and he talking that with some like this transfemoral approach with the guide can safely access to the thoracic disc pathology. But only this approach cannot easily approach to the target point. It needs more widening of the foraminal space, some drilling of the resection of the practical process, and sometimes facet joint can make a more easy way to the target point. For example, like this case is simple. Disc pathology can firstly docking to foraminal space and then the working channel insertion. After then, disc can easily remove this approach. But in like this cases, it's not easy because in these cases, you firstly docking the working channel. And some resection of the suprarticular process. Then finally, you can see some more wide space of the transforaminal space. Then remove the pathology safely from ventral part of the dura, thoracic dura. And you can see here the safely removal of the in spite of the central located disc. Sorry. And after then, you can see these images. And in the because of the if disc pathology in the only disc pathology, this pathology can be managed by the transforaminal approach to the ventral portion. But in the intraminal approach, you need some not only some such as some ossified ligament problem cases in need a safely approach to this target point. To performing these procedures, in need some over-the-top procedures needed. It already published Dr. Siepe. Please checking these procedures over the top. This is very important key of the decompression of the thoracic pathology. This year, I published this technique of the endoscopic decompression of thoracic ossification of ligament problem, and comparative result I published in operative neurosurgery. And in the thoracic OLF cases, usually some calcified portion is more cranial from the intraminal space because of that. You need more wide drilling of the bony structures. Like these procedures. After then, we can see that this view and then taken this calcified ligament problem here. This case is a 61-year male patient. You can see here T56 ossified ligament problem, and the patient complained the thoracic pain and the lower leg pain and some weakness there. Therefore, this patient performing this thoracic decompression, and firstly docking and drilling the bony structures. And the most important tip of the resection of the ossified ligament problem is exposure the cranial tip of the ossified ligament problem is very important, and also sometimes some separating the middle portion of the ossified ligament problem can safely remove the ipsilateral and contralateral calcified segment. And then after then finally we can see here this is contralateral portion. And finally take off the calcified ligament problem from the dura safely. Then finally we can see the completely decompression of the ossified ligament problem here. And the postoperative image and 1-year follow. And also in my paper, comparative with the open decompression of the ossified ligament problem, maybe vast clinical result seems like similar, but neurological recovery is more sufficient in the endoscopic decompression, and also the patient excellent clinical result can take in the endoscopic decompression cases. And also, in some of the cases, not only needed the posterior decompression, but also needed some cases of the ventral disc pathology management together. For example, like this case, this patient have some huge disc pathology and posterior ossified ligamentum problem together because of the patient came to my clinic with weakness. After same procedures, you can see the after resection of the ossified ligament problem, after then change the small scope, then you can more safely move to the rupture disc point. There you can see here the rupture disc material. And after removal of this pathology, the patient post-operatively and 1 year follow this image, and the patient motor recovered completely. And also some of cases, not only disc pathology, but also some calcified pathology from ventral and posterior part together. And also these cases also need some decompression of posterior part and resection of the ventral part together. And also in these cases, firstly, decompression of posterior part, then move to the ventral part. There can meet the ossified disc pathology, and also this disc pathology can removed by the endoscopical with a change of the small scope. And then post-operatively, you can see this image, and 1 year follow-up this image, and the patient also motor recovered completely. And also on another important thing is that in the open surgery, we many times some worry about some facet injury make some instability in the lumbar and cervical and also thoracic. But in cervical and thoracic area, these bony structures remodeled after time, and I'm also published this result, cervical result in the paper, and in the thoracic also same, because of that the sufficient resection of this posterior part it will be more safe to take good clinical safe operation. In conclusion, in the full endoscopic approach can be effectively applied to thoracic disc herniation, and good result can be obtained if the transforaminal and intraminal approach are appropriately used depending on the cases. Therefore, full endoscope approach is considered to be a good treatment method for minimization in thoracic disc pathology. And also yesterday I'm talking that this paper published by me in Neurology India, and with at the initial time I'm talking that this is a final hurdle to move to the gold standard by the endoscopic spine surgery. At the final step is the endoscopic lumbar interbody fusion and thoracic approach, endoscopic approach. With this result, we can take more than 95% of good to excellent clinical result and more than 90% patient can managed by the endoscopic in degenerative spinal disease. Thank you for your kind attention.